My name is Margaret Bell. I'm a nurse and midwife who has worked for Médecins Sans Frontières. I was in Nigeria, that was my third mission in 2009. Médecins Sans Frontières had gone there and set up working in a hospital, a Ministry of Health hospital, and working in the maternity area, in the obstetric area, and then had also started to set up a fistula surgery program. A fistula is a hole in the lining, the tissue that separates the urethra and the vagina, and can also occur in the tissue that lines between the vagina and the rectum. That hole forms because when a baby is being birthed, if the baby cannot pass through the vagina and the woman can't have a normal delivery for whatever reason, the baby will get stuck. In Australia, that woman would have a caesarean section. In a lot of parts in Africa, that's not an option, it's not available. So therefore the baby sits there, and the pressure of the head of that baby on that tissue causes that tissue to die, and hence the hole to form. So then what happens is the woman becomes completely incontinent. The urine, instead of draining straight out through the urethra, will drain in through the vagina and out. And if she has a recto fistula as well, then the faeces can drain through the vagina and out, so she has no control over that either. Obviously you want to prevent fistulas, so therefore we were working in the maternity obstetric area, training midwives, encouraging women to come in and labour within the hospital so we could pick up any problems that were occurring and manage that labour and delivery appropriately. Then we set up fistula surgery. So the only way to fix the fistula is to do a surgical repair. We employed two Nigerian doctors to work in the operating theatre, and we set up wards. So we would, the women who had this complaint, this condition, would come in for a couple of weeks before their surgery. They would be given a good diet and improve their health. They would then have the fistula surgery, and then they would stay for about a month afterwards, so we could see that they were improving. So the stigma associated with fistula can be quite extreme for some women. There can be an offensive odour, a continuous offensive odour. It's difficult for them to keep themselves clean when you are incontinent. They are therefore often isolated from their communities. That can affect their diet. If they also have some nerve damage to their legs, they aren't able to walk properly, they aren't able to access their food, so it can affect their life incredibly. And I think the thing that they then find when they have the surgery, it completely turns their life around. It's just quite extreme, the difference, and I think that's why the fistula ward was one of those really happy places to be, because the women were so excited that there was this treatment, and it did have such a major effect on their life for the better. I think the standout difference is, I guess particularly for women, is that there are so many women in a lot of countries that don't have access to basic healthcare when they're pregnant, which for us is a given. Like, we wouldn't even think that we shouldn't. And therefore a lot of deaths could be prevented by very simple care.